everybody, my name is Heather. I'm going to teach you guys about sepsis. Does anybody have an idea what sepsis is? Good idea of what sepsis is? Well, just in case you didn't know, sepsis is an inflammatory response of the body due to an infection. There are several ways that you can get an infection. One, you could have an open wound sores, or two, you could have something internal such as a UTI or pneumonia. What's the most important is to detect sepsis pretty early. This is very important because sepsis is one of the highest leading causes of death. 50% of people with sepsis don't make it past 6 months. So how do we find out what sepsis looks like? Well, there is a thing called the Sears criteria, and that's the systemic inflammatory response. And based on the criteria, if you have two of these signs, including a source of infection, then you are able to determine that it's sepsis and start treatment pretty early. So Sears includes things such as vital signs, inflammatory markers, hemodynamics, organ function, and tissue perfusion. So the first thing that you're going to check is your vital signs. You're going to look at the blood pressure. If it's too low, that's a good sign, including persistent hypotension helps determine whether it's severe sepsis or normal sepsis. A MAP of less than 65 is a positive marker for sepsis. Also, you want to look at temperature. Temperature that's too high or too low, such as 100.4 or greater, or less than 96.8 or less, is also another sign for the Sears criteria. Another thing to look at is the heart rate. Anything above 90 is a good indicator as well. Okay, so the next step is your inflammatory markers. This includes lab draws, white blood cell count greater than 1200, immature neutrophils greater than 4,000. You also want to check your C-reactive protein and prolactins. If they are 2 standard deviations above the normal, that is also a marker for Sears criteria. Next, you are going to look at the hemodynamics. When looking at the hemodynamics, you're going to consider your blood pressure. If it's greater than 90, a MAP that's less than 65, or a drop of 40 or more below the systemic or the systolic blood pressure. Those are also criteria for the Sears. Next, you're going to check your organ function. One of the things that you check for includes labs such as your creatinine, your liver factors, including your bilirubin, and your coagulation factors. Coagulation factors is a good way to determine this. INR greater than 1.5 or PTT greater than 60 seconds. Also, you can take a look at the platelets. If it's greater than 100,000, then those are also markers for Sears criteria. Lastly, you're going to check your tissue perfusion, and this you can do pretty minimally invasive. You can check the cap refill, or you can check your lactic acid. Lactic acid greater than 2 is one of the best ways to determine whether it's severe or regular sepsis. However, either or is a criteria for the Sears. Non-invasive ways to check include altered mental status, severe edema, or hyperglycemia greater than 140, especially if the patient doesn't have diabetes. The importance of checking for sepsis includes getting them treated early, because for every hour that you delay antibiotic therapy is a 7.6 increase mortality rate. So one of the ways that we treat for sepsis, does anybody have an idea how we treat for sepsis?
Antibiotics.
Antibiotics is a good one. That's initially what you want to start with. You want to do a treatment bundle system, which like we said, it was including the antibiotics. And what you want to do is you want to get your lactic acid and your blood cultures before you start your antibiotics. You want to start on a broad spectrum antibiotic. The blood cultures will help determine what infection and what is the best antibiotic to use with that. So you want to get that first. Usually that takes a little bit. So next, what you want to do is you'll eventually redraw your lactic acid within 6 hours, but you'll want to start your patient on some fluids, usually a crystalloid. You want to do 20 to 40 mils for the patient's kilogram per hour. And you want to check their blood pressure. If they have persistent hypotension, you want to start administering a vasopressor. If after that, then you will measure their central venous pressure and their venous oxygen saturation. And then if needed, you use an onotrip, such as digoxin. If their hemoglobin and hematocrit is low, you can administer packed red blood cells. And lastly, you would want to keep their blood glucose under control. It's very important to detect, and to treat sepsis fast. Does anybody have any questions? Okay, that's good. That's 5 minutes, right?